First of all, welcome and thank you all for coming. It is a little bit odd for me to welcome the new dean since I've been a long-term faculty member here and served in the interim role. And at the same time, I realized that I don't think I've really told my story in a very complete form. So today, and at the request of the lovely staff here who have been supporting us, yay. They were like, we want to know a little bit more about you, Susan. So on that note, what I'm going to do is I'm going to tell a little story about my social work career, how that evolved into my scholarly career, what I'm working on now, and in the end, why I decided to put on the hat of dean at this school. So that is today's remarks. And so like many of you, I graduated from the University of Chicago back in the day with a degree in behavioral science, which AKA means psychology. And when I was like, what the heck do I know? I have a psychology degree, but I actually don't know very much about people. So as my first job after my bachelor's degree, I took work at a family support agency doing the typical case management, home visiting, and really broad ranges of supports for families. What was common around the breadth of families I served is that they didn't fit or were between a system of care, such that I would see families that were child welfare involved, but not quite child welfare involved, parents who often, parents who had serious mental illness, but probably weren't identified quickly enough throughout the course of their lives, or went through a door that didn't serve their mental illness. And that taught me a lot about advocating for access to services when folks didn't fit, learning how to navigate a system, and really appreciating what a gift it was to do home visiting and really get to know families. It also revealed to me that I did not know what I was doing with families at all. I could arrange services, but when I was struggling to be like, how might I help a family make a change, or how do I give them more deep psychosocial supports, I was at a loss. That's when I entered my MSW program and then really got deeper exposure to the social work ways of thinking ecologically, of making sense about service system structures, and really getting oriented to the generalist, intervention model. Like, how do I really think systematically about engagement, assessment, selection of treatment, and then evaluation of services? Of course, when you do that and you start digging down then into a treatment method, you also are like, I don't know what I'm doing. So I'm about to graduate from my MSW program, and like, I wouldn't put myself in front of a client for therapeutic services because I don't know what I'm doing. I was very, very, very lucky to have a placement in and then become employed by the Institute for Juvenile Research, which was at the time a child guidance clinic, and who happened to afford a great many opportunities for real multidisciplinary work. So we were delivering mental health services, or at the time, I guess we'd call it specialty child mental health services, to the families on the west side of Chicago, which is a predominantly Black and brown community, who, came to services. There was a real engagement issue okay? Many families would come to one session and flee, okay? Throughout the course of that time, we really began with my colleagues there to rethink what specialty mental health looked like and began implementing multiple family groups to really focus, to actually try to be more responsive to the communities, to get people to maybe do a different modality of services. We did the really radical intervention of serving sandwiches during the groups, and it just really took off. We went from like coming to one session to coming to multiple sessions contiguously. That led me then to really think about, I was like, I'm going to be a family interventionist, and I'm going to go and focus my doctoral studies on really getting expert in the development of family-based treatments. While I was in my doctoral program, though, folks you never know where your career is going to go. I think this is one theme. I got employed by an educational longitudinal study to engage families so that they would stay in the longitudinal study. And it was focused on kids over the transition to high school. And why do so many children, when they were doing fine in 8th grade, drop out of school by 10th grade? So, being a social worker, I was directing these interviews, but I was like, I can't not do interviews with families. I want to do more than guide these interviews. And so I was just struck by meeting families again. I have a real hankering for home visits, meeting families in their home. And I was just blown away about how disenfranchised families felt by their school environments. And also this is not a specialty group anymore, but these are parents who are really, really striving to parent their adolescents and to connect with schools. And they were blocked in little and big ways. And so then that gets you into education content. How do we make educational organizations hospitable to the communities they serve? I think those of you who work in schools know schools are not really great at family and community engagement. It's not really in their DNA, despite an aspiration for that. So my training, okay, so to put it in a nutshell, okay, I'm doing casework. I understand that systems aren't working for families. I'm trying to get better at interventions. And then I'm seeing the context of practice and realizing and learning from different sets of folks along the way. And when the educators grabbed me then, okay? So you get into education, teachers, principals will tell you, you think you care about social justice? Well, you don't, we do, and we're doing the hard work here. So I got trained by teachers and principals with a healthy dose of what doesn't work about social work services in schools, and why they often feel that they're not doing work with us. Then I was very, very lucky towards the end of my doctoral studies to work with probably one of the first research practice partnerships in the nation at the Consortium of Chicago School Research, where then I got embedded in educational reform work around basically very, very controversial high stakes testing practices in schools, where if you didn't get a certain grade, we were going to retain you in school. And we can imagine that how that was disproportionately affecting low-income students, students of color, et cetera. And that's when I got to Berkeley. Then I graduated and came here and began my transition into really digging deeply into social service arrangements in schools. And I will tell you something really cool about coming to California. School social work is a very Midwest. It has a lot of Eastern and Midwestern roots where social work roles in schools are very embedded. I think partly because of history, California was open. And literally, when I walked into, because I had been working in partnerships with schools in Chicago, I thought it was very natural that I should visit one of my local schools, and San Francisco Unified adopted me. At that time, there were very, very few school social workers in the district, and I had the privilege of watching the growth in services over time. So that is how I got here and what drives me. So there's strands of, good old classic casework, systems work, and intervention work that form how I approach my work today. How is that for This Is Me? I don't think I've ever told that story very coherently. Okay, so taking that history into account, I would say that there are 4 conceptual themes that organize my work. In order to kind of understand schools, you really have to understand their history and organizational and institutional tendencies. Those tendencies actually make schools operate in pretty predictable ways, in spite efforts over years to change them. Then that provides an important context for social work service delivery arrangements in schools, what they're intended to do, and will give us then ultimately, how does this matter for students? When I first came here, and this is not exactly a new idea for school social work in general, folks historically have said we have to take it more than individual school social work service provision in schools. It's really important, but it has to be contextually mediated work. So I've always tried to insist that we need to better understand the grounding of social work roles in schools in terms of this larger historical and institutional set of patterns, which oftentimes will reveal sometimes when you provide mental health services to a student in school, it can have counterproductive effects because you remove them and stigmatize them by letting them not be part of general classroom processes. We often create relationships between school social workers and students when we know that really important relationships are between school social work students and teachers. Those are what we know matter. So I've thought about these institutional features of schooling. I've then thought about how organizational features of schools shape the roles of social work and other professionals within those buildings. To what extent are you able to really work collaboratively with teachers? To what extent, how do certain routine service delivery arrangements show up and serve kids? Finally, or not finally, but another strand of that is to bring this school institutional perspective to so-called vulnerable groups of students. Typically, when we think of homeless, foster students, students with mental health issues, students who are really struggling in schools, we don't think about the school context. We think about their individual trajectories. So this line of work really asks, how does school attributes shape services, and then how does that lead to student outcomes? And then finally, does it even matter? Do you have leverage here if you move up that level of analysis, right? Does it matter? And of course, the answer is yes. How you arrange services makes a difference to, to student outcomes, ranging from attendance, engagement, et cetera. Okay? So that's my past. I reflected on like, what does this all mean here? Like, what am I doing? What is the approach? How do I bring this up a level of analysis? And I realized how important it was to have the multiple disciplinary insights and abilities to collaborate across education, psych, et cetera. Because, you know, these are wicked and complex issues. And when I got to Berkeley, this was a place that not only did I have a wonderful faculty here, I could walk over to education, psych, et cetera, and they were like, get over here. We really embrace the insight of social welfare. And that is very unlike where I trained, where you would not cross a disciplinary boundary because they would kick you out. So Berkeley is very multi and transdisciplinary by nature. All of this work, I wouldn't have been able to do this work unless I was partnered with schools and practitioners in school sites. This affords you access to data. This affords you their perspectives on, I can't tell you how many times where teachers or school social workers would say, you are barking up the wrong tree, Susan. Get over here, look over here. Very important work. And then I just want to acknowledge that, that school social workers funded my early work. Some of our alumni, Cynthia and Peter Hecker, Diana Ming Chan, they would give me little pots of money to seed this line of inquiry. So it meant so much to get this, to get me up and running here. And I've always loved just partnering with practitioners on the ground. I mean, it's fun, gratifying work. And then I think partnered complex models of how the world functions really help us consider how service and context matter for those who are most affected by social work and related services. All you guys know this. This is part of the social work DNA, but those are the thematic elements, I think, of what really helped me be successful at Berkeley. Then fast forward, so my most recent work over the past 5 years is I partnered with Emily Ozer, a professor in the School of Public Health, myself, and Joyce Dorado, who we just hired a few years ago. All of us have been working in parallel with the San Francisco Unified School District. We knew we were there, but we never actually connected our resources together. And we applied for funding from the William T. Grant Foundation that really has two aims. It challenges institutions of higher education to be better partners. Institutions of higher education are bad partners. You know, like we have like the grooves don't fit together, especially this systems interaction. It's hard to pay people. There's all sorts of administrative frictions to that. So that was one element of the work. But the second element of the work was to really also work very deliberately with the district, join all the different departments in the district that we were separately working for all together to grapple with chronic absenteeism. It's been hitting the news lately. You know, we are at an epidemic crisis in chronic absenteeism. It's very disproportionately distributed such that low-income students of color, and more importantly, schools that are very marginalized have the highest rates of chronic absenteeism. We know that, it's like obvious, students experiencing homelessness involved with other systems of care also have high rates of these. Um, and, um, and then what we're trying to do is really try to integrate and align different sources of evidence. Emily, my partner, is actually reporting on this later this afternoon at a different event, who will tell us all about the strands of that work if you are interested. Shameless plug, by the way. But what Emily brought is very strong youth participatory sensibilities to this. And so it was very complementary. My participants tend to be practitioners. Her participants tend to be students. So we're trying to harmonize this information and then push the district to use the evidence, okay? And so that's what we've been working on over the past 5 years, and we are looking to expand this partnership. These are the wonderful people, including doctoral students involved. I wouldn't be there without them. But here's a little flavor of what we do. I would like to say, in part, because I was really excited about it, San Francisco really invested in collecting information from its practitioners about what they did, okay? And they did it for multiple years, making it one of the biggest service archives in the nation, okay? We've finally, through our partnership, really committed to data sharing to get this done. But what basically the themes are that, I'll give it at a top level. Just because you are absent doesn't mean you actually get support for it, right? And why? If you have the same kind of pattern of absenteeism, why is there desperate access to services? And of course, they vary across schools quite a bit. Then I think what we also noticed, there were certain types of services that were associated with worse outcomes. And one of them came under this thing about meeting with students, okay? And why would that be? Usually because meetings can be run in ways that are not very strengths-based or link up students with other more particular ways of framing absenteeism as criminal, basically, or delinquent behavior. And so that's where we've been working on this, so that what we worry about is students are not getting the same treatments. Number two, they're not getting the same potent treatments. And kids that are most effective are probably getting the most punitive treatments. So that's where we are leaving the work. We've been working very closely with the district in analysis of how they're implementing plans for attendance improvement. And we're really interested in widening this work, because chronic absenteeism is a very, very wicked problem. There's many root causes of it. It's very social, it's a very ecologically based thing. There are many reasons students are absent, some of which are related to individual or family attributes. Some of it has to do with the quality of schooling they're getting. Schools that have really bad and uninspired instruction have higher rates of absenteeism. And then finally, there are cases where there are not very great handoffs to other supports, and so misalignments there. So the next generation of our work, and it really occurred to me, I should have known this, but I realized in this work, we've really been looking within the district and not been thinking about the larger ecology of the city and county of San Francisco. So we're hoping to expand it in that ways, to do better integrated and aligned work to make sure students get access to great, safe, and belonging schools, as well as appropriately targeted services linked to their needs. So as I was reflecting on my story, I realized this is a Berkeley story, and it's a Berkeley social welfare story. In other words, I'm not unique. I come from a faculty and a program that really does try to model these ways of thinking. And when I think, one of the greatest things about being a dean is okay, there's lots of lows, there's many highs, but the highs I get are when I talk about Berkeley, not nationally to other schools of social work. I think as a dean, you're really almost more likely to say the grass is always greener on the other side. What do we not have here that everybody else has? And uniformly, these themes come up about Berkeley and Berkeley social welfare. You leverage a multidisciplinary faculty who bring a lot of different scientific sensibilities, a lot of different theoretical perspectives to very complex social issues. And in fact, we are about to have a very different senior faculty here. We just promoted 3 new professors to full in areas of organizational health, reproductive health, digital social work. And then Erin Carrison just became an associate professor. She does work on prison abolition and carcerality. And then we have this spate of new young faculty: Jamie, homelessness; Joyce Dorado, trauma-informed care; Christina Lovato, immigration services and links to the child welfare system, as well as Angie Perrone, whose name is not there, I'm sorry, and Lau Reyes, who are revitalizing the study of aging in our schools. So we've been quiet, but this school is very different than it was 5 years ago. The other thing that is really important to know about Berkeley is my partnered approach was happening at the School of Social Welfare before the field called this partnered research. We have the Child Welfare Indicators Project, which is partnering with all county agencies. We have the Bay Area Social Services Consortium. So it's in our DNA. Partnering is important when we're trying to make systems improvement and getting really kind of broad-based understanding about what actually works and really striving for equitable impact. Does it work? Is it equitable, et cetera? So those are what I see as the diamonds of Berkeley social welfare, and others recognize this as very special about Berkeley as well. So that's one of the reasons I put my hat on, because it's a great place with raw materials that I think will serve us well into the future. And so again, my part of the job is to brag. I would brag about this. It's not what I do, but it reflects what our faculty do, where our alumni go, and our brilliant students. Finally, because we are in a new growth phase, we have been making a lot of revisions to our graduate curriculums, particularly the MSW and the doctoral curriculum, to really embrace the fact that we want to reflect all the levels of social work practice and highlight our multidisciplinary sensibilities. And I think what our task is, and this is hard, is to connect all the disciplines, the different literatures and the ways they talk about the same thing in different words, to try to connect them, federate the diverse set of methods ranging from quantitative to qualitative methods in those epistemic traditions, to really think about how that work informs practice at individual, family, group, community, institutional, organizational levels. And then always reminding ourselves to use community voice. Now, all of those things aren't linked together. We know these are imperfectly linked. We know we can do better. I will be guilty as charged by not paying attention to children who are most affected by school social work services. So this is an intellectual and practice task for the future. And we've been quiet about this over the past 5 years and are just really trying. Marilyn, we're standing up alumni relations again and trying to tell our story. We have been very quiet about our story. What I wasn't expecting when I took this job was to have, I knew we would have challenges. I wasn't expecting the poly crisis that we've just stepped into. But what we have demonstrated that we are able to do is boundary span. And I think that that will get us through the next poly crisis. You know, we're managing what the hell are the roles and purposes of public education and public higher education? Does it even matter? Are we doing anything that's creating a social good? Number one, we know it hasn't quite hit, but it will hit a reconfiguration of the social safety net, which is going to impact the field very, very broadly that we're bracing for. We know that we try to get attention, and there's lots of misinformation and disinformation. How do we get evidence up and attention getting? And then we know that we are in a real crisis of connection, isolation, and polarization as a human condition. Where we're right now, we're like, folks are not well. How do we do this? Being kind of a history buff in the field, I always get inspired by Andrew Abbott, okay? Many of you remember in your social work training, we'd read something like the Flexner Report in the history of social welfare, and it was like, you're not a profession, you don't do anything, you're lame. And Andrew Abbott was a sociologist of professions who we don't listen to, but he just said wonderful things about social work. He's like, you know what? He's like, you're interesting because you are in, of, and about the boundaries. You are in cases where there's gaps between systems. You are working with multiple disciplines. You are really, the breadth of the scope of the profession is wide in terms of our scope of practice, very broad. And he often will say, well, what do you think? He's like, your values are important, your sciences are important, but they're not enough. It's really how you talk across your own boundaries in times of crisis, okay? And so many of the things that we think are going to make a difference, like we're really special at this, we're really special at that, those are assets, but they're necessary but not sufficient conditions. And I think reflect this constant pursuit of alignment to serve those who are most likely to be left in unsafe or in the cracks of systems. So I'm actually really, I try to be hopeful, and I am hopeful because I think we're on the precipice to really fight for the beauty of the profession, so that we can pursue this laser focus on those who will be most vulnerabilized now and into the future. So that's a nutshell of why I wanted to become the dean of this program. Okay, ask me questions. Okay, how did I do on time? Oh, 15 minutes. Questions, concerns?
Um, Hi, Dr. Stone. Thank you for speaking to us today. I'm a first year MSW student.
Wonderful.
Yeah, and I just want to say hi because my first year practicum is at SF Unify. Yeah, and I'm on the student intervention team right now.
Wonderful.
Yeah. And so yeah, I've been thinking a lot about school social work recently just because it's interesting working with so many layers in the school. I've never done school social work before, and I work at Gordon J. Lau and John Yihao Chen. So they're both in Chinatown. And I am hearing things about the newcomer school being kind of taken out of the school district. And I am working with that, basically the last group of newcomer students right now. So just been thinking about that a lot. Like my site supervisor was telling me, oh, maybe we can pick up some I forgot how he said it, but like just serve this population as the school system is moving away from serving that population. And I'm trilingual, so I'm also thinking about how school social work function with respect to different cultures and language and mannerism. So it's just very interesting, and I've been really liking it so far. So just want to say hi.
Well, I'm biased. I think it's one of the best scopes of practice because there's a lot you can do in schools. It seems really narrow at first, but then you're like, oh my gosh, there's so many possibilities here. Another comment I have, do you know what's silly that we haven't done? And I'm really, we have not linked our intern programs with the partnered work we're doing very well in the past. But you are reflecting, so that's another linkage we don't always connect. Um, um, and, you know, much like I'm very sympathetic to Maria Sue, the new superintendent. I see her as a new leader friend. What are you going to do when you are facing a lot of polycrisis to try to move your organization so it's responsive to the diverse set of students, and how do we do that? So those are just a series of comments, and I am so happy that you like this form of work. It's not for the faint-hearted. How's that? And there's lots of possibilities for it. It allows you to to be a micro practitioner. It really allows you to embrace the different levels of practice. Thank you.
I'm curious about, you've done a lot of work in San Francisco. I'm curious what you think of the community school strategy, especially in California, and how the social work profession might be integrated into that movement.
So I think very broadly about service delivery arrangements. And I think about them along two axes. One is the structure of the service delivery. Like, what is it? What's housing the structure and what's the purpose? And then I think about its alignment with the core of the school. And so community schools are often and can be used to really try to marry a community to the school community. I don't always see that it does that. What they can often do is just become access points, which is great too. But then we wouldn't expect them to be able to move schools forward. So I always worry, like, what gets left behind around alignment. But I love that as a form of practice. And I think when done really well and in an alignment, it really helps schools map and package the resources in their community. Oftentimes, schools will do, like, they'll have a lot of services, but they're not very organized. And it's like, so somebody needs to go in there, which I think is a very special social work role, where you're consulting with schools like, this is a great service, but it doesn't really serve our community. So we might, and I know as social workers, we hate doing that, to be like, it doesn't really work or it doesn't really fit. Are you, as an outside service provider, willing to pivot to make it aligned with our work? And sometimes they are, and sometimes they're not. Thank you.
Are we being recorded?
Yes.
Clear on that. So Randolph Hudson, MSW class 2001. Hi.
You got here right when I started here.
Yes. Yes. In fact, I think I was out the door by the time you were seated. Longtime child welfare
Yes.
professional, long time. But I go back working for Daniel downstairs in the basement.
Wonderful.
And so I want to tie these cross-disciplinary issue and really sort of, I'm also on the board of Youth Spirit Artworks, which is a small nonprofit.
Yeah.
We have MSW interns there from Cal. We're serving the homeless transitional age youth 18 to 26. So really familiar with all the failed systems. I'm interested in your thoughts about expanding into information management. And, because data sets are all over the place.
Yes.
And, and particularly I've been thinking about the School of Information Management and, this collaboration where the students come and help these organizations with their data management and data integration, systems integration. I did a lot of that work in Contra Costa, but it's incomplete, and I had to move on. And so, I think there's an opportunity for us to think about how do we manage all this information that is floating around there.
Yes.
that isn't connected, and we're not systematically managing it well.
This is a great, and now with AI, this has now become a very prescient issue, because many of us are like, oh my God, why does this goddamn place not share their data? And can we, so there's really complex, oh, did I swear? I'm sorry. It took us 20 years for San Francisco, of me being there like every year, to be like, trust me, to open up their data systems. I think this is a theme. Daniel also, systems of care, and I'm going to be the apologist for good reasons, are often like, what is this in for me? And is this meant to screw my system of care at a meta level? Okay. Number two, we're worried about data privacy on this, right? And what happens when, do we truly have ethical and durable ways of sharing information, and what about that? I actually think social work should be thinking about that too. Then I think the third dimension, and I'm using kind of an AI model of like, what are the sources of data? What are the models you're using to integrate it? Black boxes all over the place. And to what end? So I think we're toggling, like, what's the quality of the data and what are its limitations? Okay, what does it give us and not give us with these larger data sets? They give us one picture of services. So I think that's actually really exciting, and we actually have several professors here. But you're right, we are going to need to partner differently with our data science partners in ways that we haven't before. And I can tell you that that those other disciplines are hungry for social work students, because they're like, we don't know what's ethical. Like, we don't have any idea what this means. So thank you for raising this as an issue.
So I think you touched on it, that sort of the anti-science current running
Yes.
through, and it's started quite a few years ago in child welfare. There was this pushback on Emily Putnam Hornstein's work in risk assessment in child welfare, and it's even more accelerated right now. So I'm wondering, like on the one hand, I'm all about data, blah blah blah, but we've got a world that's pushing back on that. So
Oh, do you want to hear my, oh boy, should we turn off the tape recorder so that I don't get, my worry about that debate in general is that it's talking apples to oranges, okay? So of course we need the debates stem from different theoretical traditions. The critical theories are, and it's really interesting how that debate kind of doesn't even represent the intention of critical theories, which are really meta-theoretical, and like watch out for these historical and institutional tendencies, which will pattern the way data gets collected, right? Versus kind of the methods that we're using to extract these data. And then how do we take, and I get this all the time. I fight with my own team about, I'm an administrative data analysis, and they're like, your stuff is so, it's at such an abstract level that it's not touching this part of it. So that, we fight on our own team about how do these data sources fit with other levels of reality. And so I guess my Pollyanna answer to that is that's when you need boundary spanning on it that truly reflects the concerns of the literature, the explanatory or meta-theoretical orientations of the literature that then involve, like, do we have the right data? And then even if we get findings, there's another translation. What the heck does this mean for the actual practices that we do? And then does it reflect community needs, preferences, and concerns? So I would say that's what we need to be working on now.
We have time for one more question, and then we also have a question on Zoom as well.
Hi, good morning. I'm Sandy Galvez. I was a classmate of Randall's, graduated in 2001, and I've been working in public health ever since I left the program. I guess I'm thinking about the moment that we're in and the poly crisis that you spoke about. And really, and remembering my own experience as doing my internship and my MSW internship when I was in this program. How are you? And I guess the thought that keeps running through my head is like, how can the School of Social Welfare set itself up to be an added benefit to the community in this time of crisis? Right? That's what's running through my head, and so I'm really trying to want to hear more about what you're thinking about that. How you're thinking about expanding the partnerships that the school has with the actual on-the-ground service providers rather than just the research partners? Because you've talked a lot about that, but not so much about the service part, and that's what I've been waiting to hear more about.
You know what? Thank you for raising this issue. I love it when you get into places that I want us to go to. And you're right. My partnerships as a researcher here have really been oriented around like a joint research agenda, okay? You're talking about a much deeper form of partnership where a research activity could be part of it, but maybe not. But what I don't think we've done enough of, and this is a problem of social work education writ large, is we have conceptualized the practicum sites as a free voluntary service for schools, okay? And you're right. there hasn't been that much value add. And it's, to me, the value add is, I learn more from practitioners about what I don't know than anybody else. And they will always, and so that's engaged learning. You know, because most of us are doing research, we can strive for practice relevance. We are engaging in a different form of practice. We need to learn from you about this as well. And so I have been thinking about how do we do this at this time, because we will need to put our wings together on this. And you're right, it is in the service of safety net and other agencies and those who are going to be very, who either for lots of political reasons cannot put up their heads in the same way right now because of who they're serving. So you're going there. I'm trying to think about how to do that. But I do think that is a way, that is a more novel way to think about demonstrating our impact. And here's the good news I hear from the chancellor, who I love. That was the other reason that I wanted to do this job at this time. He is very passionate about the public mission of Cal. In what are we doing in service to the public? So I'm going to now you're in trouble. I believe you came to homecoming last year.
Honestly, I haven't been involved with school since I left here because my experience didn't leave me feeling like I wanted to be. If Miranda hadn't brought me here today, I wouldn't be here.
Okay, well, I'm glad.
It is because of exactly what I brought up. I never felt that the program deeply connected enough with the real world.
Yep.
And the community we were trying to serve. And at this moment, I really feel like that should be the most important thing.
Yep.
And, you know, and not thinking about how do we expand our profession or make our profession
Right.
exciting, but like, how can we do service? Because we, like all other safety net providers, will be kind of relevant
Yep.
in the future if we don't figure out how to make the, you know, like harness our collective.
Yes.
ability now.
And I don't think you and I are talking the same thing. And I do believe that there's also these embedded things that have gotten in the way of that, about whose knowledge matters. Like if, you know, assuming that practitioners don't know anything about, you know, these are really important ways of knowing, ways of learning and integrating those things. And I don't think we've done a very good job at that and have much room to improve on that. And you know who's asking for it too? The new generation of students. They're like, the world is not the way it was. Are we really hearing that the world is not the way it was? And how do we use these as transformative opportunities for, and you're right, it's not about the profession, those who will be vulnerabilized in ways that we might not even be able to imagine.
All right. Thank you all. That actually does put us at time. We would like you all to please join us downstairs on the first floor in Commons for a reception following this talk. Thank you again, Susan.
Thank you all for coming. Guess what? We have a new alumni relations and donor and so this is Marilyn. She just started, and so we haven't been talking to our alumni. So I'm excited to have this as being one, but not the only time that we get to reconnect. Because I'll tell you, talking to community members and my colleagues in the field always make me feel better that my struggle is a much larger struggle. You can feel very isolated about the world. And the more we can get together, the better. Thank you.